Welcome to Community Watch. And today we'll be talking to Tim Herrington, the Emergency Management Director. And also, this is our social distancing show. Doc, how are you?
I'm all right, sir. Zooming away. I'm a Zoom expert now. Uh, Happy to be on with you. Everybody stay with us. Community Watch starts now. Welcome to Community Watch. Greg, how you doing?
Doing fine, great.
We've got Tim Herrington with us, and we're going to talk to Tim, I know, but I just wanted to point out that this Zoom version of our show, we can't shake hands. In fact, we may never be able to shake hands again. I don't know how that's going to go.
Hey, it's the new normal. Normal.
Well, we're very happy to have with us today Tim Herrington, who is the Director of Emergency Management for Rome and Floyd County. Tim, how are you?
I'm doing fine, sir. Thank you. A little tired, but doing well overall.
Well, we've had you on the show multiple times, and never once have you talked to us about pandemic protocol.
Right.
So is that something you just forgot to tell us, or is that you weren't really planning on?
We actually started pandemic planning back in 2006.
Really?
And that was when we were planning for the H1N1 virus that was so prevalent at that point. And we never had any issues here stateside. And so in 2009, I think we changed over to pandemic planning for the Ebola virus. And again, we never had any significant issues here stateside. So pandemic planning, I mean, it's kind of been put on the shelf for a while. And once we started seeing what was going on in China, then we kind of had to start, looking at the plans, pulling it out, dusting it off, and.
But it wasn't a totally new concept for you. I mean, it was.
No, it's not. Definitely not. No.
That's what I was thinking, Tim, when you were saying that. Is it pandemic planning? I'm thinking, is it somewhat it's proactive to some degree, but then at the same time, it's very reactive because you can plan, but you don't know what's coming. So you plan for
exactly.
But
exactly, and that's the issue that we're having, is that a lot of the planning that we did for the H1N1 virus and for Ebola, the plans generally incorporated some type of vaccine being available. And with this current version that we're seeing with the COVID-19, we haven't developed a successful vaccine yet that we're able to release to everyone. And so that's been a challenge for us as well.
Well, and this may have been part of the planning and the training that you had previously, but what are some of the things that you and your office are dealing with what we're going through now?
Well, we are coordinating resources needed here locally. So if the hospitals need tents to set up for some type of pre-screening for patients before they are admitted into the hospital. We also have it's kind of a MASH style emergency hospital unit that's going to be coming in. We're in the process of setting that up now. We also have set up through the State Operations Center. We coordinate those efforts to get emergency supplies in, whether it's the face masks, the gloves, hand sanitizer, cots, protective equipment, whether it's the gowns or the coveralls. We're coordinating that as well. Plus, we have to make reports daily to the state operations center to let them know what we're doing here. Plus, we also have to get information from our local hospitals and from our Department of Public Health, and we forward that information to the state so that they're able to track the number of cases that we have here in Rome and Floyd County. And then, of course, if we do have some new cases that surface, like for instance the nursing homes, then we have to contact the state and get state resources in here. Like we just had a National Guard team come in to help assist one of the nursing homes with decontamination of their facility. So it's a lot for us to take on. Plus, with everything that's going on with the COVID-19 virus, and we're having to put out information daily to the public, cautioning them about social distancing and reminding them to if you don't have to be out, stay at home and avoid large groups. But even with all that going on, we just had a severe thunderstorm that came through, and there was a possibility that we could have some possible tornadoes mixed in with that. So at that point, we have to change gears from the COVID-19 situation that we're currently facing. Now we have to move over to the severe weather aspect of it. So it's been pretty challenging, and fortunately, we were able to come through the severe weather aspect of it fairly unscathed for the most part. And of course, we've been in contact with the state as far as resources that might be needed elsewhere in some of the other communities that did have a more severe impact from the storms than we did.
Tim, I got a question. As I was listening this morning to NPR, and it was talking about the governor, and he's really wanting to ramp up testing.
Yes.
And according to what they said this morning, I think Georgia was ranked like 47 out of our states, and far as the amount of testing that has been done. What has to happen for more people to be tested? Because we hear about this, but when you can stay in the home or when you go to the grocery store, but if people are not being tested or unable to be tested, do we even have truly an idea how many people that may have already been exposed or have?
No. There's no way to do that because I think the biggest issue is that we don't have the necessary resources to test everybody. And I think that's the biggest reason why our state is so far behind, because you look at the numbers that they have in New York City, New Jersey, in Michigan, and also what they had in Washington State, California, Texas, Louisiana, and Florida starting to ramp up as well. So I think that's the biggest reason is that the testing supplies are going to those bigger areas, and we are testing here locally. Matter of fact, we've got a drive-through testing site set up today. That's actually where I came from this morning. Happened to get that site set up. So we are testing here with the drive-through testing with the Department of Public Health and the hospitals. Both the hospitals are testing, and some of the private physicians are also testing. And then once they submit their test, and they'll either get a positive or a negative, and then any positive that they get has to be retested through the CDC just to make sure that we're not getting a false positive. And so that kind of slows down the processes. But if you look at our overall numbers, I mean, we're still going up, and for the most part, we're probably right on line about where we need to be. I know the governor had said that he's thinking probably May 1st we should reach a plateau at that point and start leveling off. So we'll see how those numbers continue. But we're testing Tuesdays and Thursdays here this week, and then next week we'll be testing Monday, Wednesday, and Friday. So whenever we test, we may get anywhere from 10 to 25 people that come through, and a lot of those people will probably test negative, but then you do have some that's going to test positive, and the ones that do test positive, that goes on to our overall count. And so our numbers are still, going to continue to go up at this point. And, we do have some other areas where their numbers are a lot, more significantly higher than what we have here. But for the most part, I think we're on the right track with our testing. And unfortunately, we don't have the supplies to test everyone. I know everyone wants to get tested, because right now, somebody clears their throat and everybody's looking at them funny, thinking that they may have something. So, so I can understand that. I understand that. I really do. And I think at some point that they are trying to develop new supplies and new testing apparatus to actually speed up the process to get the results back a lot quicker. So we're also keeping our eyes on that too, and hopefully once that becomes available, then they'll start sending that out to the different states as well, and we'll be able to start testing more of our citizens to make sure that our folks are being safe, and that we do kind of get a better number of actual infected cases than what we have right now. Because right now, I mean, it's still kind of up in the air, because I review the numbers sometimes and I find little things on there that aren't quite true, and I have to call and try and get things cleared up when my numbers don't match their numbers. But that's not to say that they're putting in wrong information, because they may have some information that I'm not getting, because someone may live in Floyd County, but they may get tested somewhere else, either in Atlanta or a different county. And when those results come back, then those numbers, if they test positive, go onto the Floyd County side of it. And then I'll see it and I'm thinking, wait, where'd that come from? And then I got to call to find out, what's that number for? Where'd that come from? I don't have that. And so you get a lot of that. And it's not just here in Floyd County. It's all over. Because I think last time we looked, there was only 2 counties in the state of Georgia that didn't have any cases as of yet, which is amazing, considering that they are surrounded by other counties that are definitely have got some cases. But I think it goes back to what you said, that a lot of people have it and just don't realize it.
Now, when you said testing, like for instance tomorrow, what determines who gets tested? Because I know you said it's very limited. You can't test everyone. So how's that determination being made, like who can get tested?
Okay, what they do is if someone feels like they should be tested, they can contact their doctor's office, or they go to the hospital, and then they'll get tested. And then if it comes back saying positive, then they get added to a list, or say if they're symptomatic, then they'll get added to the DPH, Department of Public Health list. They'll contact those folks and say, look, we need you to come through and go through this drive-through testing. Let's verify that in fact, your test is positive, or you may not have anything. And then that's where we are now. But again, I mean, it's a limited supply of tests that we do have to submit for everyone. And unfortunately, we don't have enough for all of our residents.
Tim, we're coming up on a break in just a few seconds here. So we don't want people rushing to the drive-through testing. They have to be on a list.
Yes, exactly.
So that's good to know. Well, we have a lot more to talk about with Tim Herrington, who is the Director of Emergency Management. So we're going to take a break, and we will be right back. Don't go away.
Your life is filled with opportunities to show the world you can take charge. It's waking up each day with a mission. It's working each day toward a goal. It's choosing to rise. It's charging forward with a purpose. It's changing the course of your life and taking charge of your future. If you're ready to be a Take Charger, enroll at Georgia Highlands College today.
Welcome back to Community Watch, one of our Zoom edition shows. And we are talking with the Director of Emergency Management for Rome and Floyd County, Tim Herrington. Tim, you talked about the difficulty of getting the tests that you really need. Is that true for all the other materials? Because part of what you're doing is coordinating for the equipment that we need here in the city and county. I assume that means gloves and masks and I don't even know what all else.
Exactly. Well, it is challenging. You're absolutely right about that. Because you have to look at this is a national emergency. So a lot of the supplies that we're needing here, they're also being needed in other areas around the state. So we have to go through our resource contact, which is the State Operations Center, Georgia Emergency Management. And we put in requests for those supplies. And generally, we don't want to we don't want to start hoarding a bunch of the supplies because they could be needed elsewhere. So we try and be as frugal as we can as far as ordering the necessary supplies and everything. And so some things have proven to be a bit difficult, like the hand sanitizer. It's taken a while to get that in, but I'm happy to say that we did get some in this morning. And we've already started dispersing it. The N95 masks, we have been able to get a limited quantity of those that we've been able to issue out to the different agencies as well. And there are some items that we purchase on our own, and we have to set up a COVID-19 account so that after all this is over, then we'll turn around and we'll submit the money spent for COVID-19 items to the federal government, and we'll get reimbursed on some of it, maybe not all of it, but we'll get reimbursed on some of it. But some of the things have proven to be a bit difficult to acquire, but we have to be creative with some of the avenues that we use to get those supplies as well. So fortunately, we do have a lot of folks in the community that have stepped up and have donated several items. And I've had a lot of folks that will send me emails and text messages and tell me some different contacts that they have that we're able to access and try and acquire those resources as well. So it's just a collaborative effort, not just with FEMA and with the Georgia Emergency Management Agency, but also with the community. I've got a lot of community contacts that have stepped up and send us information as well. As far as people that are willing to donate items, and then even from other states, I get emails all the time from folks from other states that have businesses that they're willing to stop manufacturing what they normally do and send out equipment to us, just wanting to help. And then of course some of you volunteer organizations as well, they're willing to step up and help out with resources that we need as well. So it's been challenging, but not frustrating. We have been able to acquire the items that we've put in for it. May not be able to get them right away. It may take a little while, but the system's working.
Tim, I had a question about if we could go back to testing for a second.
Yes.
Because if I think I heard this correct, there's several different tests, something like a fast-acting test, and then it's the test you have to send off to take several days. Um, and then I was thinking, I was hearing this morning, they was talking about there are even a test that can tell if you have antibodies for it, which means you've already been exposed.
Right.
So could you kind of clarify that for me? Because I really, when I was thinking of just one test.
Well, now, I think you and I probably watched the same news feed this morning when they were talking about the antibodies test. Now, that is still relatively new. I haven't heard of any place here in the state that's using that. A lot of what we're seeing is coming out of New York and New Jersey. A lot of these things they're testing on the folks up there because of the amount of exposures they've had up there, and of course for the amount of deaths that they've had there as well. So a lot of what we're seeing is some of the steps that they're taking up there, trying to develop some type of possible vaccine or new steps. I know at one point they were looking at the blood being donated from folks that have gone through it and had survived it, and they were looking at trying to go back and harvest some of the antibodies out of there and then re-inject that into some of the patients that were having issues with it. And of course, ventilators have been an issue. I've been watching a lot of the news feeds with the governor up there in New York, and unfortunately, the same issues that they're having up there, they're being had all over. Maybe not to the same degree because of the number of folks that they have, but some of the same difficulty in acquiring these items is prevalent everywhere. But a lot of the testing that they have, like the one that we have here, you get tested, then we have to send it to the lab, and then the lab generally takes anywhere from 3 to 7 days is the window that they've given us before we get the results back. So once you go through and you're tested, then you have to go home and self-isolate and wait for the results to come back. And then DPH will contact that person and let you know, yes, you tested positive, or no, it was negative. But in the meantime, you still have to, continue to practice social distancing and self-isolation if you do test positive. And because you have to be careful, even with our first line workers, with first responders. I mean, they have to be careful as far as them coming in contact with folks that do have symptoms. Then they have to be cognizant of going home to their family. They have to make sure that they're not carrying, transporting any of the virus back home to their families. So they're having to be creative as well. And we've actually started. We issued out the touchless thermometers so that the first responders are able to test their employees as they come in to go to work, and make sure that they're not running a fever and that they're not symptomatic. And if they are, then they have to send them home. And that's just to err on the side of caution. I mean, you really have to. So I think you hit the nail on the head when you referred to the new normal about shaking hands, exchanging greetings. After this is all over, I think we may have to really sit down and take a hard look at how we're going to move forward from this to make sure that we don't have any type of a reoccurrence of this. That may include continuing social distancing and make sure that you're washing your hands and using hand sanitizer, because that was new for us, especially here in the United States, because we're used to like you said, shaking hands and especially down here in the South, we're bad about grabbing and hugging people. So now you can't do that anymore.
I'm curious when you say that, because I'm wondering how many people may have had symptoms, because I don't know if this is something people want to admit that they had. Like, nobody wants to say I have the coronavirus. So I'm wondering how many people have had some symptoms, but because of the fear, because of whatever, have not wanted to say that. And because of that, they're still interacting with people, because let's be honest, at first it was, if you had a fever. So if you didn't have a fever, you pretty much, you didn't have it. But now we know that's no longer true, that you have other symptoms. So I'm just wondering how many people have had some symptoms, but just kind of said, I don't have it out of fear for whatever reason. And I'm wondering, is that not really what's contributing to such a spread? It's because we just don't know.
Well, I think what also contributes to it is the fact that we were right in the middle of our cold and flu season. So a lot of people could have just figured, it's just a flu or just a cold, and they'll just treat it with over-the-counter medication. And, evidently, it's worked for them. And like you said, they may have it, but they just may not be symptomatic. And even with someone that may be coughing, you may say, I just got just an itchy, scratchy throat. They go and load up on cough drops. And, over time, the symptoms kind of go away, and they figure, okay, well, I'm fine. And, maybe the coronavirus actually started here in the United States a lot sooner than what they're thinking. And it was just dismissed as just the common cold or flu that we expect during that time of year. And I first started monitoring it back in October and November when it was over in China. And I kept looking at how the numbers kept escalating and escalating. And then when they started building those hospitals over there, I said, they definitely got a problem over there now. We need to start taking a look at this seriously, because this could spread, especially if you have any city that has a major airport or train station. You look at those numbers, and that's generally where a lot of the higher numbers of exposures are, especially in New York. I don't know how many people live there now. I know back in the 80s, we always said it was 8 million people that lived in New York, and it may be 2 or 3 times that now. And that's why their numbers are so high. Same thing with Detroit.
Actually, I think they have around 40-something million now currently.
Oh, holy smoke.
Yeah.
Amazing. And then, here we are with, just under 100,000, and, our numbers are slowly creeping up, but we're a bit more rural and spread out than some of those areas. So, it probably takes a little bit longer for folks to, actually be exposed to it. And hopefully with the social distancing policies that we've got in place now, and the stay-at-home policy and the working from home policy, maybe it's going to work out better for us.
Tim, we only have a minute or so left. I think we probably ought to say that this is being recorded on April 14th, mainly because things are changing so quickly.
Exactly.
So, we may have to get a regular report from you, but what would you say that folks in Roman Floyd County could do to help you the most?
Well, I think the main thing is to help get the word out. Just tell people, social distancing is working. I know that it feels like you've been cooped up, and especially with the kids, because I've got grandkids, and they look at me all the time, and they want to see their friends. They want to go and play and spend time and go to birthday parties and all that. And at some point, once this is all over, we're hoping that we'll be able to go back to that. But for right now, we need to just keep encouraging everyone to just keep doing what we're doing. It's working, and at some point, I mean, we're gonna come through this thing.
Well, we're running out of time here. I want to thank you for being with us, and also for everything you're doing. Thanks a lot.
Thank you, sir.
Thank you all for being with us on Community Watch. We will see you on Zoom again real soon. Bye now.